Good morning, teacher. My name is Andy Reynoso, and I will talk about the hybrid minimally invasive esophagectomy for esophageal cancer. First, we have the definition. This is surgery to remove parts of all the esophagus. After being removed, the esophagus is reconstructed for a part of the stomach or part of the large intestine. The 5-year survival is to 10 to 15% among all the patients, but increases to 14 among the patients who undergo curative surgery. Application in medicine. And we have esophageal cancer removal, reduce surgical abrasion, reduce the cardiopulmonary complication, 15% lower risk, and reduce the surgical trauma.
Minimally invasive esophagectomy is performed at Massachusetts General Hospital primarily for patients with esophageal cancer, but is occasionally used in treating benign esophageal conditions. During an esophagectomy, the diseased portion of the esophagus is removed, and the stomach is used to reconstruct the esophagus. Performing the surgery in a minimally invasive fashion allows for a quicker recovery with decreased pain. Minimally invasive esophagectomy begins after the patient receives general anesthesia. The surgeon makes 5 small incisions, known as ports, in the abdomen to perform the laparoscopic portion of the procedure. Using a camera for magnification, instruments are passed through the laparoscopic ports. This process allows the stomach to be moved to replace the esophagus. In cases of esophageal cancer, extensive lymph node dissection is also performed. The portion of the stomach that will be used to reconstruct the esophagus is prepared to move into the chest. The stomach is moved to the chest, replacing the diseased portion of the esophagus. The patient is then turned and the surgeon makes 4 small incisions in the right side of the chest, avoiding spreading of the ribs. The esophagus is removed and the stomach is sewn to the remaining esophagus. Lymph nodes may also be removed at this stage. Following the procedure, the patient is awakened and transferred to the post-anesthesia recovery area. Most patients can expect to stay in the hospital for about 1 week, followed by a recovery period of 4 to 6 weeks. Minimally invasive esophagectomy has been shown to decrease length of hospital stay, diminish pain, and decrease respiratory complications compared to standard open esophagectomy. For more information on the minimally invasive esophagectomy procedure, visit massgeneral.org/MIE.
The pros and cons. In pros, we have lower incidence of pulmonary complication, limiting potential tumor spillage, easier producibility of the technique, shorter length of hospital stay, faster recovery of normal activity. The cons, we have unclear if the maximal benefit is in the abdominal or thoracic phase, expensive, and the difference with open producer is not significant.
My name is Dr. Michael Wallace. I'm a gastrointestinal specialist at the Mayo Clinic in Jacksonville, Florida. We've been very actively involved in developing new methods to improve the care of patients with esophageal cancer. Recently, we published a study that showed that a less invasive procedure was equally effective as the more invasive surgical options for removal of early-stage esophageal cancer. Esophageal cancer is a relatively uncommon cancer, but it's rising quickly in the United States, and in fact is the most rapidly rising cancer in the developed world. Esophageal cancer, particularly the form that affects the lower esophagus, is a condition that develops particularly in people with chronic acid reflux disease. In those individuals, we now have the ability to screen for the cancer by an endoscopy, and that allows us to detect earlier cancers, those that develop before symptoms develop. The symptoms that may develop include difficulty swallowing or unexpected weight loss. When we do an exam and we detect an early cancer or precancerous changes in the esophagus, traditionally the only option for treatment was surgical removal of the esophagus or very intensive monitoring. Now a new option is available called endoscopic mucosal resection. In this procedure, we can remove the tumor and precancerous changes through an endoscope without removal of the esophagus, a so-called organ-sparing treatment. In this study, we evaluated the long-term outcomes of the endoscopic procedure versus the traditional surgical procedure. We did this using a large national database available across the United States that monitors the effectiveness of cancer treatments. We evaluated more than 1,600 individuals with early-stage cancer of the esophagus, and we found that those that got the endoscopic treatment had equally good outcomes to those that got the surgical treatment. Also, we found that the endoscopic treatment is increasingly being used, whereas early on in the study, more than 10 years ago, only 1 in 30 patients got the endoscopic treatment. Now nearly 1 in 3 are treated with the endoscopic treatment, and that number is continuing to increase. Overall, the main value of this study is that it reassures patients and doctors that the less invasive endoscopic treatment appears to provide similar outcomes compared to the more involved and slightly more risky surgical treatment. For patients, I think this gives a new option for less invasive organ-sparing treatment.
Applies in Ecuador. This producer is not normally used. Luis Bernanza Hospital has been using of endoscopic gastrostomy since 2008. And the conclusion, minimally invasive hybrid esophagectomy result in a lower incidence of major intraoperative and post-operative complications, specifically pulmonary complication than open esophagectomy.
Hello, I'm Dr. Hemant, surgical oncologist and robotic surgeon. I'm the director of surgical oncology at Yashoda Hospital, Secunderabad. Esophageal cancers అంటే అన్నవాహిక క్యాన్సర్ అనేది చాలా కామన్, ఈ మధ్యలో ఇంక్రీజ్ అవుతుంది ఇన్సిడెన్స్. అండ్ ఒకప్పుడు దీన్ని ట్రీట్ చేయడం, ఎస్పెషల్లీ సర్జరీ చేయడం అనేది చాలా ఇబ్బందిగా, చాలా కఠినంగా ఉండేది. ఎందుకంటే ఈసోఫేగస్ అన్నవాహిక అన్నది మెడ నుంచి ఛాతీ ద్వారా కడుపు దాకా ఉంటుంది. సో అన్ని 3 భాగాల్లో, ఛాతీలో, కడుపులో, కడుపు మీద, తర్వాత మెడలో కూడా ఆపరేషన్ చేయాల్సి ఉంటుంది. చాలా మంది పేషెంట్స్ ఇంత మేజర్ సర్జరీస్ తట్టుకోవడం, ఎస్పెషల్లీ రేడియేషన్, కీమోథెరపీ లాంటివి ఇచ్చిన తర్వాత ఆపరేషన్ చేయడం అనేది చాలా ఇబ్బందికరంగా ఉండేది. బట్ ఇవాళ రోజున ఇదే ఈసోఫేజియల్ క్యాన్సర్ ని మనము మినిమల్ యాక్సెస్ సర్జరీ అంటే థొరకోస్కోపిక్ సర్జరీ లేకుంటే రోబోటిక్ సర్జరీ ద్వారా చేయడం వల్ల ఏమైతుంది అంటే ఈ ఛాతీలో మన పెద్ద ఇన్సిషన్ అంటే పెద్ద ఘాటుని, తర్వాత కడుపులో కూడా పెద్ద ఇన్సిషన్ ఘాటు లేకుండా చిన్న కీ హోల్ సర్జరీ ద్వారా చేయొచ్చు. దీనివల్ల ఏమవుతుందంటే పేషెంట్ రికవరీ చాలా స్మూత్ గా ఉంటుంది. సర్జరీ వల్ల జరిగే ఇబ్బందులు ఏవైతే ఉన్నాయో, నొప్పే కానివ్వండి, పేషెంట్ ఊపిరి తీసుకోవడానికి కష్టమైన పరిస్థితే కానివ్వండి, ఐసీయూ స్టే, యాంటీబయాటిక్స్, పెయిన్ కిల్లర్స్ యూసేజ్ అన్ని తగ్గి ఇంత మేజర్ సర్జరీ చేసిన తర్వాత కూడా పేషెంట్ ని కొద్ది రోజుల్లో, ఒక 4-5 రోజుల్లో మనం డిశ్చార్జ్ చేసి మళ్ళీ వాళ్ళను ఫిట్ గా ఇంటికి పంపించే పరిస్థితి ఉంది ఈ రోజుల్లో. ఈ లేటెస్ట్ అడ్వాన్సెస్ రావడం వల్ల రిజల్ట్స్ తో పాటు పేషెంట్ టాలరెన్స్ అంటే పేషెంట్స్ తట్టుకునే అవకాశాలు కూడా ఇటువంటి పెద్ద సర్జరీలను చాలా ఇంప్రూవ్మెంట్ ఉంది. సో అందుకని ఈ రోజుల్లో ఈ మేజర్ సర్జరీస్ అంటే వాటన్నిటికీ భయపడి బెదరాల్సిన అవసరం లేదు. ధైర్యంగా ప్రొసీడ్ అవ్వచ్చు. మన హాస్పిటల్స్ లో ఇప్పుడు మాకున్న ఎక్స్పీరియన్స్, ఎక్స్పర్టీస్ తోటి ఇవన్నీ మంచి రిజల్ట్స్ ఉన్నాయి. సో పేషెంట్స్ అపోహలకు పాలై సర్జరీస్ కి యాక్సెప్టెన్స్ లేకుండా ఉండడం అనేది జరగకూడదు.